Good day, everyone. My name is Kofi, and today I will be discussing the ethical considerations surrounding the refusal of treatment, particularly through analysis of two case studies. We'll be exploring the tension between the ethical principles of autonomy, beneficence, and non-maleficence, and justice using these case studies to delve into real-life dilemmas in biomedical ethics. Before we dive into this case study, I would like to define some key terms and definitions. Number one being refusal of treatment. Refusal of treatment occurs when a patient decides not to receive medical intervention or care despite the recommendation of healthcare professionals. This can happen in life-threatening situations where a medical team believes intervention is necessary for survival. Autonomy. In biomedical ethics, autonomy refers to the right of individuals to make decisions about their own lives and bodies. It is the foundation for the right of patients to refuse treatment. Autonomy emphasizes the importance of respecting a person's capacity for self-determination. Beneficence is the ethical principle that refers to the duty of healthcare providers to act in the best interests of their patients, providing care and interventions that promote well-being and prevent harm. Non-maleficence. This principle, often stated as do no harm, emphasizes that healthcare providers should avoid causing harm to patients. This includes both avoiding harmful actions and preventing potential harm from occurring. Finally, justice. In the context of healthcare, justice refers to fairness in the distribution of resources, care, and treatment. It emphasizes equal access to healthcare and the fair treatment of all patients, ensuring that no one is unfairly denied treatment. Our first case involves Maria Lopez, a 36-year-old woman who was in a severe car accident and required a blood transfusion to survive. However, Maria was a devout Jehovah's Witness, and her religious beliefs prohibited blood transfusions. The medical team faced a dilemma. On the one hand, they needed to act swiftly to save her life, but on the other hand, Maria refused the transfusion based on her religious convictions. Maria's autonomy as an adult with full mental capacity allowed her to make this decision, even though the medical team strongly advised against it. This case brings us to the principle of autonomy, which is the right of individuals to make decisions about their own bodies and healthcare. In this case, the medical team had to respect Maria's wishes, even though it likely led to her death. In this case, autonomy is undoubtedly at the forefront. Maria's refusal of treatment, grounded in her deeply held religious beliefs, exemplifies the principle of autonomy in action. Autonomy in biomedical ethics refers to, as we know, refers to patients' right to make decisions about their own body and healthcare, free from external influence. Even though the medical team could have saved her life with a blood transfusion, Maria's right to make decisions about her body in this case overrides the medical team's desire to intervene. This brings us to an important ethical dilemma. How do we balance respecting a patient's autonomy against the obligation to act in their best interest? However, Maria's case also presents a conflict with the principles of beneficence and non-maleficence. According to beneficence, healthcare providers are bound to act in the best interests of their patients, striving to provide treatments that enhance well-being. In Maria's case, that would have meant going forward with the blood transfusion, which had the potential to save her life. But then we encounter non-maleficence, which is the principle of do no harm. If the medical team were to force a transfusion, they would likely violate Maria's autonomy, and in doing so, potentially cause her harm by disregarding her personal and religious beliefs. This brings up a key ethical challenge. While medical professionals are bound or duty bound to act in a way that promotes health and life, they must also avoid causing harm, particularly harm of a moral or psychological nature, which could result from imposing treatment against a patient's wishes. This scenario brings justice into play as well. Justice in the context of medical ethics relates to the fairness and the equitable distribution of healthcare. The ethical questions here becomes, should society or medical professionals override a patient's autonomy for the greater good, particularly in a case where life can be saved? Is it just to compel Maria to accept life-saving treatment, or is it more just to respect her decision despite the tragic consequences? Here, the principle of justice requires us to consider not just the individual case of Maria, but also the broader implications. If autonomy is overridden in one case, where do we draw the line? Should society prioritize saving lives over respecting personal decisions, or should the individual's right of self determination always take precedence? Moreover, respecting Maria's autonomy in this situation, while tragic, raises an important reflection about the value of personal beliefs and the role they play in healthcare decisions. It prompts us to think about the deeper questions of whether respecting autonomy, even in cases where the outcome may not be favorable, is inherently more important than intervening in a patient's treatment to preserve life. Should the medical system, in some instances, have the power to override a person's wishes for a greater good? And who determines what the greater good is? Especially when it comes to personal belief systems that may be at odds with standard medical practice. This case asks us not to only think about how we handle such situations, but also how the principles of autonomy, beneficence, non-maleficence, and justice interact with sometimes conflict with each other. It's clear that no single ethical principle can be applied in isolation here. Autonomy cannot be respected without considering the potential harm caused by that decision, and neither can the principle of beneficence be followed without potentially overriding a fundamental right to self-determination. This complex balancing act is at the heart of ethical dilemmas in healthcare, and is where many of the most difficult decisions arise. Our second case involves Ethan Miller, a 7-year-old boy diagnosed with leukemia. The survival rate for acute lymphoblastic leukemia is very high, with chemotherapy over 90%. However, Ethan's parents, Sarah and Daniel Miller, rejected chemotherapy in favor of alternative holistic treatments. The doctors were faced with a stark decision: respect the patient's wishes, the parents' wishes, or intervene to save Ethan's life. This case is particularly challenging because it involves parental authority versus the welfare of a child. According to bioethical principles, parents usually have the right to make medical decisions for their child. However, when a child's life is at risk, this right is not absolute. In the case of Ethan Miller, we once again encounter the tension between autonomy and beneficence. Ethan's parents, Sarah and Daniel, are exercising their autonomy by refusing the chemotherapy treatment that doctors strongly recommend. As parents, they feel it is their right to decide what treatment their child should receive. Autonomy in this context allows them to make decisions about their child's healthcare based on their beliefs. However, this choice is in direct conflict with the medical team's obligation under beneficence to act in the best interest of the child, which in this case would mean administering chemotherapy to save his life. The doctors are aiming to do what is best for Ethan, guided by medical evidence that indicates a high chance of survival with the treatment. The principle of non-maleficence, or do no harm, is essential to this case. While the parents' decision is based on their autonomy by refusing chemotherapy, they are putting Ethan's life in jeopardy. Not providing chemotherapy, which is the most effective treatment available, would directly harm him by reducing his chance of survival from 90% to just 10%. This clearly violates the principle of non-maleficence, as it exposes Ethan to unnecessary harm, both physically and potentially psychologically, as he faces the progression of his illness without receiving life-saving care. This situation reached a point where the medical team, along with the legal system, had to intervene to protect Ethan's well-being. The doctor's duty to act in the best interest of the patient is critical, particularly when a child is involved, as minors are not always capable of making informed decisions on their own. The involvement of the court system here shows how medical professionals and legal authorities work together to ensure that a child's right to life and survival is upheld, even if it means overriding the decisions of the parents. This intervention can be seen as a practical application of beneficence and non-maleficence, taking action to do good and to prevent harm to the child, despite the parents' wishes. Finally, justice plays a pivotal role in this case. Justice involves fairness and equal protection of the individual's right, particularly the rights of vulnerable populations. Children like Ethan are considered vulnerable because they cannot always advocate for themselves in medical decisions. The state has a duty to ensure that the children receive the necessary care to protect their health and well-being. In this case, justice demands that the state intervene to ensure that Ethan receives the chemotherapy he needs. The state is tasked with protecting his life and ensuring that the parent's beliefs, while important, do not place Ethan in a position where his survival is unnecessarily at risk. In the context of justice, the state's intervention is not only morally justified but necessary to ensure that Ethan's right to life is protected. This case highlights the complexities of balancing parental rights and children and child welfare. Particularly when the child's life is at risk, it also underscores the role of justice in healthcare, as the state has an obligation to intervene and protect the rights of individuals who cannot protect themselves. While parents have autonomy over their children's medical decisions, this right is not absolute, especially when refusing treatment threatens the child's survival. The case of Ethan Miller thus provides a clear example of how the principles of autonomy, beneficence, non-maleficence, and justice must be carefully weighed and applied in practice, particularly when vulnerable individuals are involved. Both cases highlight the complex balance that must be struck between autonomy and beneficence, as well as the role of justice in medical decision making. In Maria's case, we saw that autonomy was respected, even though it led to a tragic outcome in contrast. In Ethan's case, beneficence and non-maleficence took precedent, and the state intervened to ensure that the child's life was saved, despite the parents' refusal. The common morality approach tells us that autonomy should generally be respected, but there are situations where beneficence, acting in the best interest of the patient, must take precedence, especially when life is at stake. This is where justice also comes in, ensuring that individuals, especially vulnerable ones like children, are protected from harm, even if it means overriding parental decisions. While the refusal of treatment often involves individual cases, it also raises a broader ethical and practical issues that healthcare professionals must navigate. One of the key complexities in refusal of treatment involves cultural sensitivity and religious beliefs. How do healthcare professionals handle patients from cultural or religious backgrounds that prohibit certain treatments? For example, as we saw with the case of Maria Lopez, a Jehovah's Witness, refusing a blood transfusion respecting a patient's autonomy becomes much more challenging when the beliefs contradict on medical advice. In such cases, healthcare providers are faced with the difficult task of honoring the patient's religious or cultural beliefs while still fulfilling their ethical duties to provide care. It is essential for healthcare professionals to approach such issues with cultural competence, understanding and respecting the patient's worldview while also ensuring that informed consent is obtained and the patient's right to make autonomous decisions is upheld. However, this also introduces a dilemma. Should cultural and religious beliefs override the health providers' mm, professional judgment when the life of a patient is at risk? These situations require sensitive conversations and, in some cases, legal consultation to ensure that the patient's autonomy is respected without causing harm. Mental competence is another critical issue. In cases where patients have diminished mental capacity, whether due to age, cognitive impairments, or mental illness, the question arises: who decides what is their best interest? Autonomy, which is usually the cornerstone of patients' rights, may be compromised in these situations. For example, minors or individuals with severe cognitive impairments may not be able to fully understand the consequences of refusing treatment. In these cases, healthcare professionals and legal guardians must step in to determine what is the best interest of the patient. This raises important ethical and legal questions. Who has the right to make decisions for an individual who cannot make informed decisions themselves? Is it the responsibility of parents, guardians, or the healthcare team to decide? In some instances, the state may intervene, as seen in cases involving minors, to ensure that life-saving treatment is provided, even if it goes against the family's wishes. The ethical challenge is balancing the patient's right to autonomy with the need to protect vulnerable individuals from harm. Medical paternalism versus patients' rights. Finally, we must address the ongoing debate between medical paternalism and patients' rights. The tension here lies in the question: should healthcare providers respect patient autonomy even when the patient's decision is potentially harmful, or should doctors acting in what they believe to be the patient's best interest override the patient's wishes for the greater good? This is the essence of medical paternalism: the idea that healthcare providers may act in the patient's best interest even against their express wishes, if they believe it will benefit the patient in the long run. This debate is particularly prominent in cases where a patient refuses treatment that could save their life or significantly improve the quality of their life. Should the healthcare provider intervene to protect the patient, even if it means overriding their wishes? On the other hand, patient right advocates argue that the autonomy should always be respected, and it is never justified to override a patient's decision, even for their own good. These ethical dilemmas are at the heart of many medical ethics debates, and navigating them requires careful consideration of both the patient's rights and the healthcare provider's obligation to do no harm and act in the best interests of the patient. In conclusion, the refusal of treatment in medical ethics is a deeply complex issue that involves balancing competing principles. The four principle approach helps to guide healthcare professionals in navigating these dilemmas, but each case is unique and must be approached with care and sensitivity. We have seen how autonomy, beneficence, and non-maleficence interact with justice in real-world situations, and how these principles must be balanced against one another to achieve ethically sound decisions. These case studies highlight the challenges faced by medical professionals, legal systems, and families when a patient's refusal of treatment conflicts with the duty to preserve life and interests of vulnerable individuals. Thank you for your attention and looking forward to your questions and thoughts on Tuesday.